You know, we're talking about aches and pains this morning, and when you wake up in the morning and you're kind of feeling that way, is it really happening to you or is it all in your head? We're talking about fibromyalgia this morning, and I've got Dr. Ken Muhich here. He's the CEO of Fibromyalgia Wellness Center. And, you know, I mean, I just thought maybe I had my little aches and pains because I'm getting older, I'm kind of maturing a little bit. But let's explain the definition of what fibromyalgia really is.
Well, fibromyalgia is a chronic condition, and you'll find a lot of health providers find the word condition as a problem with fibromyalgia, but I call it a condition based upon our research that has a number of symptoms involved with it. It is a condition whereby you can have as many as 18 points of pain, 4-quadrant pain, which means it can be any area of your body. It can be left shoulder, right knee, low back. It could be your stomach. It moves all over your body. You should have it at least continuously for 3 months. And fibromyalgia is one of those things that, like I say, has a number of different symptoms, everything from headaches. You could have what's called alopecia, hair loss. You can have a great deal of fatigue. Of course, pain is one of the other things also involved with it. And we've not found any fibromyalgia patient in years that just has fibromyalgia. Fibromyalgia is a condition whereby it magnifies other conditions. So every fibromyalgia patient that we have ever had has multiple conditions along with fibromyalgia, and fibromyalgia magnifies those other conditions.
So it's not just one thing in particular that triggers it.
Well, actually, research has shown that fibromyalgia oftentimes is triggered by some physical, emotional, or chemical trauma. So it could be auto accidents. It could be, let's say, coming back from a war. It could be some other health condition that you may have, a surgery, so forth. It could be molds and spores in your home. So all of those things can actually trigger fibromyalgia.
Would you consider it also an autoimmune? Because you're talking alopecia, that's an autoimmune.
No, it's really not an autoimmune disease. It is not one of those things that actually damages or destroys any kind of a tissue. It's one of those things that gets into your muscles. Matter of fact, it's not even a joint disease. It was given to rheumatologists, I guess, just because it couldn't fit anywhere else. But it is not a disease that actually causes damage to joints in itself. It's primarily muscular, but it actually affects all of the different organs in the body.
Well, let's talk about that. And does it affect more men versus women? I mean, I think kids can even get this too.
Research has shown that there is a genetic marker, and it can actually go from one generation to the next. Correct.
Okay. And so now here we've got some examples of some things here. Let's talk about this right here.
Yeah, this is actually from the American College of Rheumatology, and this shows the 18 specific points. And what we do is, this is one of the factors that we use to diagnose fibromyalgia. And we press, we don't have, you know, you can push on any of it. Does that hurt? You know, no, we don't do that. It's a moderate form of pressure, and the patients will say whether or not it's mild, moderate, or severe. Now, for fibromyalgia patients, as I mentioned, you have to have the 4-quadrant pain and at least 3 months of pain, so forth, and fatigue and symptoms. But you have to have at least 11 out of 18 of these that are tender.
Oh, and now you also do a diagnosis with a process that's called mapping. Explain that.
Well, that's not a diagnostic thing. Our actual protocol was developed actually by a doctor from California. He's an MD, is Dr. Saint Aman. He wrote the first book on fibromyalgia, and what we did was we added a pre-protocol onto that so it works a lot better. But anyway, Dr. Saint Aman actually devised this where you can actually test the patient, and fibromyalgia patients have obviously, all of the fibromyalgia patients have lumps and bumps. They can have anything from pea-size to marbles. They can also have fluid under the skin. And so what we do is, in mapping, is we test on the different arms and legs and so forth and find out where these are at. Then we mark them down, and then as the protocol goes along, they start feeling better, these start to disappear. Now, a lot of patients come in and say, I can't understand why I have all these different things on my body. This is part of it. There's chemicals that actually build up within the muscles and tissue that actually form these different lumps and bumps on their body.
Treatment options. How would you treat a patient? I know we've got some supplements here. I know you have a process, and you also have a book that you mention all of this in too.
So we found that The most important thing is fibromyalgia patients have a lot of inflammation within their body, and if we can reduce that, then the protocol works a lot better. So for the first approximately 2.5 weeks, we put them on a detox. We also place them on high doses of omega-3. Omega-3 is important because it's an anti-inflammatory naturally. We place them on something called magnesium. Magnesium actually stimulates the batteries in your body so that you have more energy, because energy is a real problem with fibromyalgia patients. Also, they have something called fibrofog. They have a difficult time concentrating, and so this reduces that. We also place them on conjugated linoleic acid for this period of time. Conjugated linoleic acid actually burns fat off their body because most fibromyalgia patients are inactive, and so from year to year, if they don't exercise, 5 to 10% of their body's lean tissue turns into fat or adipose tissue.
Oh my gosh.
The protocol itself includes something called guafenicin, and Dr. St. Amand found that guafenicin pulls a lot of garbage out of their system and allows them to start feeling better much more quickly.
Detox, and we're running out of time. And boy, so much information in so little time, Doctor.
Right.
Thank you so much for sharing this with us. And go visit him at the Fibromyalgia Wellness Center. We'll be right back after this.